Hey everybody, welcome back to Madison County Live. We have a very special segment with Kelley McBride and Carlos Coyle. Kelley, I'm going to let you make the introduction and just go to it.
Sure. Joining me today is Carlos Coyle, and he is no stranger to many of us in Madison County. He is the director of our Madison County EMS, and I wanted him to join me on this segment to just kind of let everybody in Madison County have an idea of what he is facing during the workday and his perspective on what's going on in Madison County regarding COVID-19. So unfortunately, we have to keep talking about COVID-19.
Right.
And because our case counts are up, our incident rates are up, there's hardly a county in Kentucky that is not in the red zone, which is a very high incidence rate. And the situation is very serious. And I can't stress that enough. We always want to have good news here on Madison County Live, and I appreciate you guys for letting us do that. And that's what I love to talk about too. Sure. And I always want to, focus more on the positive than the negative. But the reality is, COVID-19 is here. The Delta variant is here. It's not going away anytime soon. So our marathon with COVID-19 is still ongoing. We're not across that finish line. And I know that Carlos will join me in urging everyone to get a vaccine, wear a mask, wash your hands. We've been saying that for a long time. I think we kind of relaxed a little bit a few months ago and thought, okay, well, we're seeing the light at the end of the tunnel. It's almost over. And everyone is fatigued. And so I just urge people to don't give up doing the right things. Stay the course. And we can all get through this together. And I want to also thank everyone who has already gotten their vaccinations.
Right.
Our vaccination percentage is low, but it's not really bad. It could be better.
Sure.
But we are inching up just a little bit. So I did want to say thank you to all the Madison County folks who were able to get their vaccine and made that choice. And we're grateful for that, because that's how we're going to get through this pandemic. We're going to get a handle on COVID-19 through vaccination.
Absolutely. That's right.
So without any further ado, I will let Carlos have the floor, so to speak. And I would like him to give his perspective on what he's seeing in the county.
Okay.
Thank you.
Thanks, Kelley. Thanks, everybody. Thanks for having us here. This is an important conversation, one that we hoped that we would not be having at this point, but unfortunately we are. Anecdotally, we are busier now with mostly, I assume, the Delta variant than we were initially with COVID-19. This week has been particularly impactful. The number of EMS calls have skyrocketed. We had one of our busiest days on record Tuesday, actually, and many of those calls were COVID related. And as someone had said earlier, that one of the differences that we're seeing with this new variant is they are younger, it's coming on quicker, and they're sicker. So we're seeing several folks on ventilators. Obviously, everybody knows healthcare resources are stretched absolutely razor thin. There's long wait times at emergency departments, at other places like that, and it just can't be helped. There's a shortage of workers. There's a huge increase in influx of number of patients, and we're seeing that in our area hospitals as well, which we can't offload patients quickly, so we can't turn around and get back in service for that next 911 call as quickly. Luckily, those times are not terrible, but as it continues, they're likely to get worse. And some areas of our country are seeing ambulance wait times of 1 to 3 hours for them to offload patients in emergency departments. So we certainly hope that never happens here, but that's the reality of this pandemic.
Right. Do you know, I know you had mentioned, and fortunately, Madison County, Carlos, like you said, it's not as bad as in the bigger cities. So that's a good thing.
Right. But the resources are limited. Healthcare
Right.
workers in every facet are working overtime, many hours, busier probably than they've ever been, and it's taking its toll on the healthcare workers, first
Sure.
responders, and a lot of other folks that this is impacting. And we keep hoping we see light at the end of the tunnel, that there's an end to it. We felt good a few months ago when we were never so happy to take down, some of the restrictions and signage and things like that. But just this week, we put a lot of them back up. So we're kind of back to where we were. And it's kind of a morale killer, if you will, for the healthcare workers to think we almost got out of it, and then deja vu all over again.
Wow. Carlos, speaking of that, what should people do for, and basically go back to what we were doing before, correct?
Right. I mean, that was obviously working. Vaccinations are important. I know there's a lot of controversy out there, but I think if you look at any of the statistics, the large majority of people who are sick that are admitted to the hospital are typically unvaccinated. The vaccine is not perfect, but it is the best tool we've got. That, along with all the other common mitigating factors that Kelley already talked about, washing your hands, distancing, masking when appropriate, and things like that.
Right.
Every little thing you can do may make a big difference.
Yep, that's absolutely true. And Kelley, speaking of vaccines and information, where can everyone go to find out how they can get their vaccine?
Sure. Of course, we want everyone to visit our website, MadisonCountyHealthDEP.org. You can search. There's a couple different links and sites that you can go to find a vaccine. So vaccines.com, I think it is, or .org. There's one for the state vaccine map that we've been promoting as well on some of our spots. So they're easy to find. The vaccines are available. They're easy to get. They are free. They will not cost you anything. So please seek those out. You can get online on our website to schedule an appointment for a vaccine online. There are pharmacies I know White House Clinic offers all three different vaccines, or they have been able to offer all three.
Okay.
We also have guidance on our webpage for what to do if you've been exposed to or tested positive for COVID-19. There's an infographic that explains it. There's links to documents that you can read and print out on the webpage. So please look at those.
Okay.
Also, COVID testing sites, knowing where those are is very important. So we recently updated our testing site list, and we're trying to promote those.
Sure.
That is on our website as well. So please be aware of all of those things.
Absolutely. And, I always send, a lot of time Colleen and I get asked, where can we find this information out? I always send them to the Madison County Health Department because it has all the clearinghouse information at that site with the links and all the good information there.
Yeah. Well, I must say, you need to go to the state's website as well, and the CDC if you want even greater information.
Sure. Yes.
So we are always encouraging people to check out the state. They have great dashboards with information, a lot more in-depth information than what we can get. But yes, please, start with us and move up.
Yeah, exactly. Well, and now I know I'm talking to my phone a lot. So search wise, all you got to do is search that stuff on Google, and it'll the verified sites will always pop up first.
Yeah. And if you need to talk to a person, a real human being,
sure,
you can call us here at the health department as well. And we have wonderful caring nurses who would be happy to speak with you, nurses and staff.
Absolutely. And that number is it? Let me guess. 623-7312. Am I correct?
That is correct. I'm proud of you.
Absolutely. I got it right. Well, thanks, folks, for coming on. Carlos, do you have any more wrap-up information just about how important it is for your EMS workers?
Well, all I can do is ask for people to do proper guidance
Right.
and take care of themselves, take care of each other. One thing that we are seeing is entire households who are positive. So
Hmm.
obviously, this Delta variant is much more contagious, maybe than the previous COVID-19 variant. And it is spread very quickly. But do everything you can to mitigate your risk. Uh, the more people we have that are able to obviously not become infected, then the better we're able to deploy our resources. But healthcare is stretched. It was stretched
Right.
before COVID, and it is stretched beyond extremes now. And it's not just here; it's all over the country, and frankly, all over the world. But especially the emergency part, first responders, health departments, and all that. Uh,
Hmm.
we're kind of the safety net. When
Sure.
everything else goes wrong, we're kind of the last resort to keep everything together. But everybody's doing the best they can. They're working under tremendous uh, stressful conditions. Our EMS workers and other first responders out here, it's tough enough in facilities. It's climate controlled to wear all the PPE and gowns and
Right.
gloves and masks. But you can imagine being out here in 90-degree heat and humidity trying to do that. So, just if you see a healthcare worker, think, it's a tough
Absolutely.
time. I've been around it a long time, and this is the toughest situation we've dealt with.
That's true. That's for sure. So thank your EMS worker, your healthcare professionals, wherever you may see them.
That's right. Kelley and Carlos, we thank you so much for your service to our community. Folks, it's going to take all of us working
Hmm.
together. I know we can do this, but please support one another in this effort. And once again, we can't thank you enough for everything you're doing to help keep our community safe. Carlos and Kelley, we appreciate you.
Thank you. Thanks for getting the word out.
Thank you all.
All right, we'll be right back.